What up, guys? So I just got off of work. This is shift 3 of 4 for me this week. So I'm fried. I don't have makeup on. I'm crusty. I'm waiting for my shit to heat up in the air fryer. But I wanted to make this video really quick because I had a girl comment on one of my other TikToks asking for advice because she just got hired as a detox nurse. And so I just want to make this video and talk about some cons of being a detox nurse and why you should not become a detox nurse. Alright, first reason why you shouldn't become a detox nurse: you have bias against addicts. You would think that this goes without saying, but I have come across people who work in different fields, and when I tell them, oh, I work in detox, they're like, oh, why would you want to do that? Why would you want to work with a bunch of drug addicts? Like, in a really negative tone, and it honestly pisses me off, but that's a different conversation. I understand not every person who's an addict is ready for recovery or wants that. I understand that not every person who may be homeless and an addict wants to recover. And so people can have poor experiences with people, and I understand. But you have to understand that working in detox, it is not mandatory treatment. And what I mean by it is not mandatory treatment, a lot of inpatient detox facilities are not a requirement and people are not forced to be there. So the people that are coming into the detox facilities that I work at are voluntary. So they are there because they are actively trying to reach sobriety. And that's a lot different than if you work in EMS, or you've worked in the ER, etc. Maybe you've dealt with people who are not pleasant because they're going through withdrawals. Maybe they're really paranoid because they don't like being in the hospital, etc. Maybe they were forced to get treatment. I don't know. There's a lot of circumstances, but you have to come in with an open mind and break down those biases before you become a detox nurse. If you are triggered by people giving you their substance use history, this goes without saying, but I still need to say it, because when people go in depth about their substance use, whether it's alcohol or drugs, most of the time they're going to be truthful with you because, again, they're there voluntarily. So it can be triggering for people to hear how much people are using, how they have been using it, like IV drug use. So whether you have been an addict and you're in recovery or you have not been an addict, it can be triggering in different ways for different people. So you need to come with a mindset that that's not going to trigger you, and coming from a no judgment standpoint is the kind of recovery and the kind of nurse that these people need. If you have a hard time setting boundaries and saying no. So obviously when working with people in recovery, they still have certain habits that are not necessarily good ones that they're trying to unlearn, right? From years of trauma and doing what they need to use in the past. A lot of the times they can have bad habits of like drug seeking, lying, trying to be manipulative, that kind of stuff. Obviously that comes with the territory, but that's not every single person. But you still need to be able to say no and have strong boundaries as a nurse. If people being a frequent flyer makes you mad or triggers you, this is not the field for you. I've had it where patients complete programs, they're doing so good, they're set up for success once they leave the detox facility, and then they're back a week, a month later, etc., etc. It happens. Once again, this is not the ER. It is a lot different, y'all. These people are actively wanting to be there and to try again, and they have a limitless amount of tries. So if someone constantly coming back makes you mad, or you get mad at the idea of someone being a frequent flyer, do not work in detox, period. If you do not like working in psych, or maybe you don't have a psych background, detox may not be a super good fit for you. Not every patient has psychiatric diagnoses or symptoms, but a lot of them do. A lot of the time, having psych issues and having an addiction is very common, at least what I've seen. I have a extensive history working in adult psych as well as adolescent behavioral health. So I feel like that has really benefited me because I don't take shit personal. I understand when people don't feel good, they may say shit that is mean. I also am really good at verbal de-escalation. So if you don't like working in psych, like, do not work in detox. And the point of this video is not to discourage anyone from becoming a detox nurse. This is just me trying to be real, because when you're out there, you need to be real and straightforward with these patients. And that takes a special type of person and a special type of personality to work in this specific specialty. So if you've worked in corrections, if you have worked in any sort of psych, behavioral health, or maybe you have had family with addiction, maybe you're in recovery yourself, maybe you've had friends with addiction, if you have some sort of knowledge and background, you're gonna fit in really, really well and you're gonna like it. Versus if you don't, I can't guarantee that this is gonna be the right fit for you. And that's just my opinion, but I'm just trying to help other nurses out.